All right. Hello.
Hi, how are you?
I'm good. I'm Carrie. I'm going to be your provider today.
Wonderful.
How can I address you?
Audrey.
Audrey. It's nice to meet you, Audrey. I'm just going to wash my hands, and we will get things going.
Woohoo!
How can I help you today?
I have a headache.
Oh, I'm very sorry. Do you get headaches often?
Yeah, all the time.
All the time? How many days a week?
Oh gosh, probably like 5.
Oh, all day?
Sometimes, but not usually. Usually for a couple hours.
A couple hours. What kind of pain?
Usually like right behind the eyes, right behind the temporal region, and sometimes in the back of my head like squeezing. Sharp,
Dull, throbbing?
Throbbing.
Any other symptoms with it?
Sometimes nausea.
Nausea? Any dizziness, fatigue?
Occasionally dizziness. And I feel like fatigue always comes with it as well, yeah.
Yeah. Any recent weight loss?
I wish.
You wish? Fair enough. Just for checking, can you tell me what the date is?
It is January 26th, 2023.
Perfect. When is your date of birth?
3/8/85.
Perfect. What did you do last month? Pick a day.
I had surgery earlier this month, but last month was Christmas. We celebrated Christmas.
How was that?
It was good.
Yeah?
Yeah.
Do you remember everything?
I mean, I think so. How would I know? How would I know? I might need to check it with someone else.
Fair enough.
Hayden's oranges. Hit the timer.
So, I'm just going to get a little bit into mental health for a little bit. Any mental health history?
No.
No. Any family history of mental health?
Yes. My
Yes.
mom's pretty crazy.
Yeah. Any diagnosis on her side?
No.
No. Just what kind of symptoms?
Kind of crazy.
What's your insight to it? What would you say?
She's just impulsive and unpredictable at times.
Fair.
And often childish.
That must have been very difficult.
It's great.
I'm sorry.
It's okay.
Any thoughts of harming yourself or anybody else?
No, not regularly.
No. Have you ever had any thoughts of harming yourself?
No.
No. No history of taking medications for mental health.
No.
Fair enough. Do you feel safe where you're living?
Yes.
Are you in a relationship right now?
Yes.
Do you feel stable?
Yes.
Are you married?
Yes.
Do you have kids?
I have 3 kids.
3. How old are they?
15, 14, and 2, almost 3.
Okay. Any illicit drug use?
No.
No. Ever?
I mean, back when I was younger.
Yeah. What made you stop?
I got older.
I guess.
I got less fun. I don't know.
Do you drink?
Very rarely.
Okay. How many times a month?
Maybe like 3, 4.
Okay. In those 3 or 4 times, how many servings do you have?
Probably between like 2 and 4.
Okay. With friends, self?
Yeah, friends.
Friends. Okay. What kind of network do you have? You have close friends, multiple friends?
Yeah, I've got close friends. Not too many of them, but that's okay.
Okay. Are they a positive?
Yes,
influence?
most of the time.
Okay. Any religious or spirituality?
No.
Okay. Fair enough. All right. Let's wrap back around. Do you take any medications?
I take Imitrex for my headaches, and sometimes Topramax. Well, not sometimes. Sometimes Imitrex, always Topramax.
Okay. What's the doses on those?
100 twice a day for the Topramax and 50 for the Imitrex as needed.
Okay. When's the last time you took those?
This morning.
This morning. Did they help?
The Imitrex did, yes.
Yeah, the Topamax, no.
It doesn't.
Is that
It's
common?
preventative. Sometimes it usually keeps them from happening, but sometimes when I miss doses,
Do you have
they pop up.
auras?
What's that?
Do you have auras with yours?
Not always. Occasionally, but nothing that like really stands out. If I have an aura, I usually typically get dizzy as well, just because it affects my vision.
Okay. Fair enough. Are you allergic to anything?
Yes, Dilaudid, but I don't think that applies here.
Any allergies to latex?
No.
What happens when you get Dilaudid?
Anaphylaxis. It's fun.
On the skin, injection, anything?
Anything. Yes, anything.
Okay.
I mean, I have a pen for it. Because I work with it.
How do you handle that?
Fine, I think.
Okay.
I don't.
All right. Any allergies to environmental?
I have seasonal allergies. Typically, ragweed causes the most issues, but high pollen counts can too.
Oh, you take anything for those?
Claritin and Zyrtec. Not at the same time, but just sometimes one works better than the other, or I get too adjusted to one and it stops working, so I swap to the other.
When you have seasonal allergies, about how long does it last?
Depends. Typically late in the summer, couple weeks, and sometimes early in the spring for a couple weeks.
Okay. All right. I'm just trying to think of what else. We covered latex, medications, what-
Environmental.
environmental, dietary. Any dietary
No
allergies?
dietary allergies.
Okay. What other medications you take?
Currently Tylenol. Had knee surgery, so
Ooh, I'm sorry. That's no fun.
no.
Do you move at all?
Occasionally.
You should move.
Yeah, trying.
It's important.
It is.
How much Tylenol do you take?
And taking 3 grams a day.
Whew.
Yeah. Apparently ibuprofen slows healing, so they said to take Tylenol.
Okay. That's what they recommend?
Unless they're recommended, so here we
Is
are.
it working for you?
I mean, I feel like Tylenol doesn't do much, but
Okay.
trying.
But keep going.
Yeah.
Okay.
It has to be doing something, right?
Do you have a follow-up with them soon?
The 20th of February.
Okay.
I had one 12 days after surgery, so.
Perfect. Sounds good. All right. I think we covered most mental, social. You working?
Yes.
Obviously, maybe not right now.
Not currently, but typically, yes.
How many hours a week?
Anywhere from 36 to over 40. It
Ooh,
depends.
nice.
Yeah.
Busy?
Yeah, very, very busy.
Okay. You like your job?
I mean, some days. I like the people I work with.
There. That's great.
Yeah.
Going to school?
Yeah, that too.
That's great.
Oh, yeah. Some people would say that.
All right. Any other medical history?
Not that I can think of. I mean, I had my tonsils out when I was in my early 30s. But other than that, no.
Okay. How about family medical history? Brothers, sisters?
My sister's a little neurotic. She's got ADHD. The other one, I don't really talk to often, so I'm not sure how she is or what's going on with her. As far as like medical problems within the family, none that I'm acutely aware of. I know that my mom's father was a huge alcoholic, and he died of cancer as a result of that, and so did my uncle.
Okay.
Both very big alcoholics, but other than that, nothing
Okay.
that really sticks out.
All right. Did that have any effect on you?
No.
No. Okay. We talked about medicines, medical history, family history. Mother, father covered. That's about it for that. I think for history. All right, let's move into an exam.
Deal.
All right, we'll start with the head. Look at the eyes, nose, ears, mouth, neck, and then call it. Is that fair?
Mm-hmm.
Okay. We'll start with the head. I'm going to have you take your ponytail out. Any problems with skin?
I do have eczema, actually, now that you mention it, on my neck and my hands, but
Anywhere else?
no.
No. Where did it start?
On the hands.
On the hands.
Yeah.
And then went to the neck?
Yeah.
It's kind of unusual.
It showed up on the day of my surgery, in fact. The only instructions were if you have any rashes, and I was like, it's not new. It's just flaring, I swear. Not contagious.
Fair. Dry skin?
Yeah.
Any moles or anything you're concerned about?
No.
Hair growth? Any issues? More, less?
I have hirsutism, so I do get some on my neck and chin.
Okay. Do you use any sort of like lotion or product?
I just use it like a generic face wash and some like moisturizer every day
Okay.
with the SPF.
I'm so proud of you.
Trying to
It's so important.
stave off that aging. And I'm really white, so it's really important.
Fair enough. All right. Bye, bud. Just gonna throw. I don't have gloves, but if I had gloves, I would put some gloves on.
Deal.
Okay.
You've got invisible gloves on.
We got invisible gloves on
I
today.
like- yes.
So that we can stay within our sight. All right. Hair looks good. separate a couple areas. I don't see anything outstanding. No dandruff, no nevi. Does it hurt anywhere?
No.
You have any abnormalities in your head scalp?
Not that I'm aware of.
Any history of head injuries?
Yes, I've had a couple concussions back in the day.
Yeah.
Long time ago.
May I ask how?
One was a car accident, one was a boating accident, and one I just walked into a door jam.
Were you ever hospitalized?
No.
Okay. You have any issues with TBI?
Probably, but not that I have any treatment for. I did get a CT for 2 of them, so
Oh, okay.
we're
That's positive.
yes.
I'm proud of you.
Thank you.
Okay. All right. I'm just trying to think. Last track. We're going to look at the eyes, I believe, next. If you're okay with that.
Yep.
Any issues with your eyes?
I do typically wear corrective lenses.
Okay. Do you have them on right now?
No, but I
No.
can grab them whenever we're there if we need them.
Have you had a vision check lately?
September of this year. Last year.
How'd that
Not
go?
this year. Unchanged.
Any issues?
No.
Do you have dry eyes?
Only really when I have allergies or but typically they're fine.
Okay. Any bright flashy lights, curtains?
No.
No visual disturbances?
No.
Blurry vision?
No.
Double vision?
No.
All right. And with your allergies, do you get runny or dry?
Yeah, typically runny nose, and sometimes my eyes will water, or sometimes they'll dry out. It just really depends on
Okay.
the time.
All right. Just gonna shine a bright light. You can stare off right behind my head. Just gonna check for reaction. Left side looks good. Right side looks good. Opposite side looks good. Probably about a size 3. I'm happy with that. So I'm just gonna grab above
okay. I have hooded eyelids.
the sclera are white. Conjunctive look good. No drainage. No redness. All right, there. I'm gonna take a look at your eye a little bit closer. We're gonna get nice and personal. I'd have a mask on normally.
Same.
All right, I'm just gonna have one eye here. Again, kind of look up behind me. And I'm just gonna look in so that I can see. I can see reaction. Your iris looks good. Pupil looks good. I'm just looking at the disc. You look at the margins and the vessels. And it's nice and yellow. You got clear margins, vessels appear normal. You doing okay?
Yeah.
Okay. I didn't poke you in the eye or anything?
No.
Okay. Other side. Again, pick a spot behind me. Just let me know if there's any pain or discomfort. Again, this side looks the same. Great margins, good coloring. Vessels look unobtrusive. I'm happy with that. Thank you.
Mm-hmm.
You can blink. Anything?
No.
No, I'm just going to touch right in here. Any pain up here?
No.
Any issues here?
No.
Skin feels warm, moist. I'm going to try and get that to turn off for a sec. While we're here, I'm just going to take a look in your ears if you don't mind.
Not at all.
Do you have any history with your ears? I know you said you had your tonsils removed. That caused any issues?
The left ear, I feel like the Eustachian tube, ever since I had my tonsils out, the ear just doesn't drain good. So if I have a head cold or any sort of facial congestion, I have a lot of pressure in the cheek and the ear. But it's
Okay.
not constant. It's just if I'm ill.
You do anything for that?
Usually Sudafed helps a little bit, but I don't really like taking Sudafed.
Yeah.
So, no.
Do you do the sinus rinses at all?
Yeah.
Do you like them?
They're kind of weird, and they
Yeah.
kind of make me want to vomit, but
Okay.
sometimes they're helpful.
But helpful? Worth it?
Sometimes.
Not worth it?
It depends. It
Okay.
depends on how congested and how desperate I am.
Okay. Have you had any recent hearing loss, hearing drainage from the ears, pain?
No.
No. Any concerns on your ears right now? No. All right. We will start with this one. Inspect the external ear. The skin is intact, no redness, no pain. All right, dear. You're gonna feel me just pull up a little bit, and I'm just gonna take a look. All right, perfect. Clear of any wax blockage. Eardrum looks great. Yeah, pearly gray, no redness, no swelling. Tone of light 7 on the left. Great. Does that bother you at all?
No.
Nope. Okay. I'm gonna try the other side. Again, compared to the other side, ear is symmetrical, intact, no pain, no redness. Sorry.
You're fine.
There we go. This side has a little bit more wax on it, but tone of light is at 3, pearly gray. You look good. Thanks for letting me look. Any other medications or anything you take for your ears?
No.
Have you had a hearing test at all ever?
Not recently.
No. Did you ever have it checked in school when you were younger?
Yeah.
Did you have immunizations when you were younger?
Yes.
Okay. Have you had a flu shot at all this year?
Yes.
How about a COVID vaccine?
Not this year, but I've had 3.
Yeah. I'm gonna see if this will do it. I might need to change. All right, I'm just gonna take a look at your nose right over here. Outside of the nares look good. No redness. Everything is intact. I don't notice any drainage. Just gonna grab on your nose. Okay. You can see terminus. There's a little bit of clear drainage with some hair. Septum is not punctured. You can see the inferior. Great. Doesn't look like you do cocaine.
No, not regularly.
There's no holes in there.
That's good. There shouldn't be.
Alright, other side. Oh, dog's coming in.
He wants his nose like that.
Great pink membranes. Again, a little clear. Your little hair's intact. Let's see, inferior terminate. Right. Spectacular. I'll try not to poke you in the nose anymore.
It's okay. Fairly hardy.
Alright, I have this big scary tool. I'm just going to take a look in your mouth after I shine myself in the face.
Wouldn't be, the whole thing if you didn't find yourself in the process.
Alright. Any history of dental work?
So I have the last 2 molars on this side, both top and bottom, removed.
Okay.
And then other than that, nothing major. There's a crown back there too. I'd go to the dentist for 7 years at one point. Really hate the dentist, and I paid for it. So here we are.
Have
They're
you
all
gone
good now.
recently?
Yes, I go every 6 months now.
So proud of you.
Safe.
That's good.
Yes.
Have you noticed any bleeding in your gums, any pain, irritation?
No.
No. Any wounds in your mouth?
No.
Around the lips, sores?
Dry lips, but comes with the season.
Fair. And nothing on the skin at all with face, any redness marks that you've noticed?
No.
Okay. Do you have dry mouth at all or any sensitivities?
No.
No.
I just eat a bunch of Oreos, so I apologize. But
Okay. Have you felt like anything's draining from your sinuses down at all?
I feel like I probably have like a steady state of like mild postnasal drip, but
Okay.
it doesn't really bother me. So
How about a sore throat?
no,
No pain?
no,
Okay. Swallowing
fine.
without difficulty?
Yeah.
Can eat lots? No
Oh,
issues?
too much sometimes.
Drinking's fine?
Yes.
Okay. Just gonna take a look.
Mhm.
Can you open up? Perfect. Pink, moist, tonsils are +2, uvula is midline. I don't see any wounds. It's moist, teeth are intact, none of them missing. You lift your tongue up. Perfect. Upper palate, under the tongue are intact, no wounds.
It's still recording, just taking a nap.
Took a nap. All right. Lips are intact. Everything looks great. And no pain, you said?
Nope.
Okay, perfect. If you don't mind, I'm just going to do some more hands-on.
Yep.
I am, hi, bud. Just feeling for lymph nodes.
Mm-hmm.
We got some tonsillar lymph nodes, some mandibular, and these ones, cervical lymph nodes, superven, I forget the big word for those ones, and then some back here. Any pain?
No.
I felt them. There's no hard. They're movable.
Mm-hmm.
Everything looks good as far as those. Have you ever noticed any swelling or any pain?
No.
No. Okay. I'm just gonna take a quick listen.
Mm-hmm.
Just to your lung sounds up above.
Mm-hmm.
And your carotids. We'll start with the carotids.
Mm-hmm.
My other side is not working right now. No bruit. Strong. You haven't had any lightheadedness?
No.
No. Okay. Any troubles with your thyroid?
No.
Can you take a swallow for me? Perfect. Midline. It's symmetrical. We like that.
Okay.
Didn't you have any family history of thyroid issues?
My mom's hypo.
Have you been checked recently?
Yeah. I make them check me every year just in case maybe that'll help me lose weight. No luck yet, but keep posted.
Alright, I'm just gonna listen into your ear for today.
Hush.
Any respiratory issues?
As a child, I was told I had sports-induced asthma, but that is not a thing. So more recently, a provider said maybe reactive airway disease, but I don't have any chronic issues with it, just usually when my allergies are bad.
Okay. Kind of wheezy, or what kind of symptoms?
Yeah, kind of
Cough?
wheezy, just feeling tight and a little bit of a cough. Sometimes the cold air can do it too, but not often.
Okay. I'm gonna go back up to eyes because I forgot a couple things.
Mm-hmm.
Why don't you tell me when you notice on your left side?
No.
Okay. How about on your other side?
No.
Okay. Perfect.
Get down, puppy. I know.
I'm gonna start up here.
Mhm.
You follow this finger and don't move your head. We're gonna go down and back up and across and up and down, back up. I'm gonna come in. Tell me when you can't see me anymore. Great. Just checking ocular movement and muscles. Are you able to read? And usually we hold these about 14 inches away.
Mm-hmm.
Go ahead and tell me smallest line you can read. And you do not have corrective lenses on.
Correct.
You normally wear them, okay?
Right. I would say CFDHJ.
Okay. And then can you cover one eye and do the same thing? Can you see the same, or do you have to go smaller?
I can't see the F great, but I can see all the other letters, so I can see CFDHJ.
Okay. Cover the other eye. Adjusted?
Yep.
Okay.
EPTZO.
Okay. So 20/30 on the right, 20/25 on the left.
Mhm.
Okay. Do you remember, does that sound about normal
Yeah,
for
it
you?
does.
Okay. All right. I'm just trying to think, what can you think of? Is there any issues or anything that you can think of that have been different or changed?
No, none at the top of my head.
No. Do you see neuro for your headaches at all?
No, probably should. But
No. Have you ever been consulted neuro?
No.
Have you ever had a scan done for your migraines?
No.
Have you ever had the migraine workup?
No.
LP?
No.
None of it?
None of it.
Wow.
My provider doesn't like me.
Today's your lucky day.
Woohoo! Were you a love puncture on the table?
Yes.
Sweet.
Is that going to be an issue?
No, it's fine.
Okay.
Great.
Perfect.
Sounds fun.
Well, it sounds like, do you feel like your medications for your headaches are giving you relief?
Yes, but sometimes it takes a while to get there. This one I was fortunate in that it helped. Sometimes it doesn't. Sometimes they, I've had ones that last for a couple days on rare occasion. And then I also very recently learned that if you take too much Imitrex, you have rebound headaches. So it says you can take it twice, but if you feel like you need to take it twice, I feel like you should probably, decide it's time to go be seen and not take it twice.
Not take it twice. Have you ever journaled your symptoms?
No, but I probably should.
Probably should.
Yeah, I'm a great healthcare provider and not a great healthcare receiver.
Fair. Maybe you could journal, and then, if you had a neuro consult.
I'd have all of these wonderful things to tell them.
Yes, you would.
Good idea. Thank you.
You're welcome. All right. I'm going to, maybe. Yeah. I'm going to put this right in the middle. Can you hear the same on both sides?
Yes.
Okay. Feels the same, hears the same? Okay. Just tell me when it stops. This one's gonna last forever.
Okay, can't hear it anymore.
Okay.
Okay.
Okay. Perfect. Do you have any questions for me?
I don't think so.
Do you have anything that you would like change or want to try different?
I don't know. The migraine meds are kind of finicky. I have baseline hypotension, so a lot of the meds that they use to relieve or prevent migraines, I'm told, can also lower blood pressure, so they've avoided them at this point. So, but
What's your blood pressure do?
it's usually in the low 100s over 60s and 70s.
Okay.
Yeah.
How about, you've never had fevers or temps or neck pain with your headaches?
No.
No other rashes?
No.
No concern for that?
No.
Okay. Joint pain?
I mean, yeah, but probably because I just had knee surgery.
Okay. All right. If you don't have any other questions, we'll conclude for today with a follow-up later.
Sounds great.
All right.
Look forward to it.